The nurses union at University Medical Center is planning another strike for next week.
Well, that's because after nearly 2 dozen bargaining sessions, the two sides haven't come to an agreement just yet.
Meg Ferris sat down with both sides and has an update.
In March, it'll be a year since the state's first nurses union has been negotiating with UMC for a contract.
We've been in 20 negotiation sessions so far, but we still haven't seen significant movement to major proposals that we've submitted.
So the nurses have planned a 2-day strike midweek of the Super Bowl.
Honestly, we would like to not strike. Our whole goal is for the hospital to say, hey, look, we hear you, let's work together.
For the first time, UMC is responding, saying the hospital will continue at the bargaining table, going through the back-and-forth process, but said it cannot discuss details. One issue is safety for staff and patients. One change the hospital already made is metal detectors and ID requirements at the door.
We have, a large public safety department here that's supplemented also by private security. We have a camera system throughout. We have, screenings for visitors that are coming into the hospital, and we take any incident that occurs seriously.
And UMC says the hospital will not be understaffed when the nurses are on strike Super Bowl week.
We'll still be fully staffed throughout. So we'll bring in replacement nurses that'll be here, they'll be working. We've worked with a lot of these nurses previously on our previous strike, and so we know what they can do. And it was a good, solid team of nurses.
I would love for the hospital to reinvest that money or invest that money that they are planning on spending on outside nurses into the nurses that we have right now.
The nurses also want to see higher staffing and floating nurses on a unit so they can give better bedside care.
Our staffing and our ratios are good, they remain good. We've received that from them to where they felt like our ratios were adequate.
So the hospital was prepared for the mass casualty incident on January 1st?
Absolutely. As a Level 1 Trauma Center, we were fully prepared for the MCI. We had the staff that we needed. We took care of these patients. We're proud to have done that.
In the meantime, the nurses want higher wages, so some don't need to take on a second job.
We want the hospital to know that this is not an us versus them. We are on the same team. We are trying to accomplish the same goal, which is patient care.
Meg Ferris, WWL, Louisiana.
The nurses also want free parking. That benefit can't happen until a contract is negotiated and ratified by a majority of union members. The next round of talks is in mid-February.